Hi, my name's Yakub and I'm the student representative for the Rural Community Clinical School. This is the Rccs.
Community Clinical School is Deakin's longitudinal integrated clerkship program. It's a year-long rural immersion experience for students in Year 3 of the MD course, in which students get to spend a whole year working alongside experienced rural practitioners in the Grampians region. Here we are in Halls Gap today, and in the southwest of Victoria.
Over a 12-month period, Rccs students are allocated to a GP clinic and health service within one of the following towns, allowing students to experience general practice in country Victoria and also gain clinical exposure through the medical and surgical services offered by the hospitals affiliated with each of the towns.
The way the program works is students are placed in a town with at least one other student for 12 months, and they work in a general practice clinic doing parallel consulting, and they also spend time in the local hospital and places like urgent care department and other community health facilities.
Unlike other clinical schools that are affiliated with Deakin University, the Rccs curriculum follows a longitudinal integrated clerkship model. Through this model, students encounter a wide range of clinical presentations, which when complemented with online learning, gives students the opportunity to cover the same material that's encountered in that conventional rotation-based manner. It also gives students the opportunity to consolidate their understanding of the different rotations over the entirety of a year, making it less likely to be learnt and dumped in that rotation-based manner. By engaging with general medicine, surgery, obstetrics and gynecology and paediatrics over the course of an entire year, students have ample time to consolidate their understanding of both theory and clinical aspects and monitor their progression over the course of an entire year.
Hi, come in.
Hi, Pia.
Hi.
So, can you tell us a little bit about what to expect in the GP placement in the Rccs?
Yes, so what we do here is a model called parallel consulting. So as you've seen here, we've got our own rooms and we will have patients come in to see us. We will take a really good history, which is a great practice, do physical exams, review results that they've had, order any tests, write referral letters, prescribe medication. And then once we're done with all of that, we'll call our GP supervisor back into the room, give them a handover of what we found, what we think is going on, and what we think we should proceed with. And then our GP supervisor will give us feedback and suggestions on how to improve. And then we've just seen the patient by ourselves.
Throughout the year, Rccs students travel roughly every 7 weeks to either Geelong, Warrnambool or Ballarat for a week of face-to-face teaching. This includes the delivery of tutorials and presentations by experienced clinicians from the respective towns, covering common conditions from the MD3 curriculum. The face-to-face sessions also give students the opportunities to learn and practice clinical skills and consolidate these skills in a practical manner using state-of-the-art facilities within each of the health services. In this way, students have theoretical content reinforced in a practical manner.
At the Rural Community Clinical School, we get the opportunity to have an amazing immersion week at the Royal Children's Hospital for our third-year paediatric rotation. We get exposure to kids at the neonatal ICU, paediatric ICU, general medicine, and most importantly, the emergency department.
Unique to the Rccs, students are hosted by the Royal Children's Hospital in Melbourne for a week of intensive paediatric exposure. This is a unique opportunity for MD3 students in the Rccs, with opportunities to consolidate paediatrics, a core rotation within the MD3 curriculum. Students join medical teams throughout various disciplines, engage in clinical skills practice, and gain first-hand exposure to children's health through the lens of the major hub of paediatric medicine within Victoria.
So there you have it, folks. If you're looking for an incredible year of hands-on experience and becoming an integrated member of the medical team, then you've found that perfect opportunity in the RCCS. Personally, I've had the year of my life. I've been able to get my clinical skills and reasoning improved to levels I haven't even imagined and could not imagine doing at any other site. Good luck with your choice of clinical schools, and I've got to run off. I've got a cholecystectomy that I'm going to scrub into. See you later.